Cardiovascular disease is the #1 killer in the world and the #1 cost to the U.S. healthcare system and to most developed countries worldwide. So this is a problem of lack of prevention and lack of early diagnosis.
And if you don't have a score of 0, the calcium score is limited in that it only tells you that there is plaque. We don't know if you have blockages, we don't know if you have soft plaque, but as the tip of the iceberg, you think about the Titanic going downstream. The Titanic's going there and it sees an iceberg off its bow. And it saw a big iceberg and it didn't say, oh, let's send divers below the surface to see if there's anything under there that could rip the hull. It knew, based on how much ice it saw, that there's a bigger problem underneath the surface of the water, right? 80% of an iceberg is below the surface of the water. The same with coronary calcium. It's the 20%. It shows you the 20% of the plaque. We know that if you have a lot of coronary calcium, what's below the surface of the water is really, really significant. At the beginning, a disease is easy to cure, but difficult to diagnose. But as time passes, not having been recognized or treated at the outset, it becomes easy to diagnose, but difficult to cure. So that's what we've been doing for a long time. And anyone who in cardiology who calls themselves an interventional cardiologist is at the far end of this spectrum, right? They're waiting for the patients to have heart attacks and then they're getting in there and trying to help fix things. And they do a lot of great things, but it's too little, too late, right? That's the phrase we like to use. But that concept of too little, too late came from Machiavelli in the late 1400s.